the coronary artery bypass grafting is one of the most striking surgical procedure ever been created in the history of medicine. And this procedure was born in late 1960s, and in the beginning they are using the saphenous vein graft to bypass the coronary artery because it's very easy to handle. However, in the middle of 80s, we found that the vein graft deteriorate with time, and at 10 years after the operation, nearly half of the vein graft occlude. On the other hand, in the few group of surgeons utilize the internal thoracic artery as a conduit of the coronary bypass, then we found that this arterial conduit stay patent very well at 10 years or more. And also we found, more importantly, the difference of patency rate of those two conduits directly related to the patient's survival at 10 years, 15 years after the operation. So now we really understand that we have to use the mammary artery very aggressively, and also to find the other arterial conduit suitable for the coronary artery bypass. And then now we have a gastroepiperic artery and the radial artery. Those two conduit are now very frequently used instead of the saphenous vein in the certain group of the doctors. And for me, I started out the gastroepiperic artery in 27 years ago, when I was 36 years old, very young. And now I have experience with more than 1,500 cases by using a gastroepiperic artery, and survival rate is very good comparing with the saphenous vein graft patients. And also the patency of the gastroepiperic artery is much better than the saphenous vein graft. So if we consider the patient outcome, particularly in the survival, in 10, 20 years or more, we really need to use arterial graft more aggressively. That is my point of view. As far as the surgery has done by surgeon's hand, we really need a arterial conduit forever. But as we know, the mammary artery graft is very good, but not all surgeons using those arterial conduits full range. So we must teach for the young generation what to do, and they should accept and learn this technique more aggressively.
You are what we say a classic cardiac surgeon. Do you believe in minimal invasive cardiac surgery?
Oh yes, this is one of the progress. And of course patients are happy if the wound is small and painless and short hospital stay. So this minimally invasive technique is very good progress of the heart surgery. But it takes surgeon's effort, and more than that, some more proper device are necessary. So the surgeons and industry should catch up to improve this minimally invasive technique. But it works, I'm sure. First of all, I was surprised what a beautiful place here is, because we are living in a very far east small island, and no precise information about Croatia so far. But now I understand these wonderful places, and I'm sure that many Japanese will come to enjoy. And scientific part of this meeting, it's quite high. And there are several reasons, but many top players of heart surgery are gathering. And very frankly speaking, not in the distant between the young cardiac surgeons. So this kind of atmosphere here is very good for the good relation between the old age like me and the young generation. This is fantastic.